Did you know tuberculosis is one of the oldest and deadliest infectious diseases still threatening millions worldwide? TB is caused by the bacterium Mycobacterium tuberculosis. It typically attacks the lungs, but can affect other body parts like the kidney, spine, and brain. It's a serious, potentially fatal disease if not treated properly. This infection spreads through the air. When someone with active lung TB coughs, sneezes, speaks, or sings, tiny droplets containing bacteria are released. Inhaling these droplets can lead to infection. Close contact over time is usually needed for transmission. It's not spread by shaking hands, sharing food, or touching surfaces. Public health efforts focus on identifying and treating infectious cases quickly. Latent TB infection, LTBI, means bacteria are in the body but inactive. There are no symptoms and it's not contagious. However, LTBI can progress to active TB disease later, making identification and preventive treatment crucial. Active TB disease means bacteria are multiplying and causing symptoms. A person with active TB disease in the lungs or throat can spread bacteria to others. Prompt diagnosis and isolation are vital public health measures. TB is caused solely by the Mycobacterium tuberculosis bacteria. However, certain factors increase the risk of developing active disease after infection. Close contact with an infectious person is a primary risk. Living in crowded settings or having weakened immune systems significantly increases vulnerability. Conditions like HIV/AIDS, diabetes, or certain medications compromise the body's defense. Populations experiencing homelessness, substance use disorders, or those from countries with high TB rates also face higher risks. Public health programs must prioritize outreach and testing for these groups. Symptoms of active TB disease often include a cough lasting 3 weeks or longer. Other common signs are chest pain and coughing up blood or sputum. Systemic symptoms like fatigue, unexplained weight loss, loss of appetite, fever, and night sweats are also indicative. Recognizing these symptoms early is key for timely diagnosis and preventing transmission. Diagnosing TB involves several methods. Skin or blood tests can detect TB infection. A positive test requires further evaluation to rule out active disease. Chest X-rays help visualize lung damage. Sputum tests are critical for confirming active pulmonary TB and identifying drug resistance patterns. Public health labs play a vital role in accurate diagnosis and surveillance. Preventing TB spread is a public health priority. The BCG vaccine is used in many countries to protect children from severe forms, though its effectiveness against adult pulmonary TB varies. Avoiding prolonged close contact with infectious individuals is important. Ensuring good ventilation in shared spaces reduces airborne transmission risk. Public health campaigns promote respiratory hygiene. Identifying and treating LTBI prevents progression to active disease. This is a key strategy, especially for high-risk individuals. Maintaining overall health supports a strong immune system. TB is curable with a course of antibiotics. Latent TB is treated with fewer drugs for a shorter time to prevent future active disease. Active TB disease requires a combination of multiple antibiotics for at least 6 to 9 months. Completing the full course is absolutely essential to cure the infection and prevent the development of drug-resistant TB, a major public health challenge. Directly observed therapy, DOT, where a healthcare worker watches the patient take their medication, is a cornerstone of TB control. It ensures adherence and improves treatment success rates. Tuberculosis is preventable and curable, but requires coordinated efforts. Healthcare providers, public health teams, and communities must work together to report cases, ensure treatment completion, and raise awareness. At-risk individuals should get tested promptly. Effective TB control relies on shared responsibility and commitment.